Erin, ever since the pandemic, Medicare patients have had waivers that cover their telehealth costs. So it's allowed them to manage chronic conditions without having to leave their homes. And it's also allowed patients in more rural parts of the state to have easier access to specialists that they need to see. But those waivers have to be renewed by Congress each year. They have bipartisan support, but because of the government shutdown, they haven't been approved for this year. Dr. Leslie Island with Nebraska Medicine helps manage diabetes for a lot of her patients, and she sees most of them through telehealth at least some of the time.
They don't know if their insurance will pay for the visit, and they're worried that if they proceed with the visit that they may get a large bill and the entire charge for the visit will be returned to them.
She says almost every year she and other doctors hope those waivers are passed through Congress and make backup plans in case they aren't. She says patients need to be able to access telehealth so they can have consistent prevention care, and that the current model of yearly renewals is not sustainable.
This is the first time we're having to pick up the phone and call patients and let them know that due to the failure of Congress to extend these waivers, we now have 3 options for them.
She says Nebraska Medicine is choosing to continue telehealth visits potentially at its financial cost through the 10th. After that, patients have to either cancel, reschedule to an in-person visit, or choose to keep the telehealth visit knowing they may have to pay out of pocket. I also spoke to the Nebraska Hospital Association president. He says he's worried as seniors lose access to telehealth that they'll put off management for chronic diseases, and that could lead to more expensive emergency room visits people can't afford. Nebraska hospitals will have to eat that cost. In the studio, Zena Taher, First Alert.